Next, we're going to hear from Dr. Krigger, Dr. Karen Krigger. She is a professor in the Department of Family and Geriatric Medicine at the University of Louisville School of Medicine and Director of Health Equity for the Health Sciences Center. She is a Louisville native. Her clinical practices include primary care services and HIV services. She is dedicated to educating both the public and medical professionals and students on diversity and inclusion topics, among other things. Welcome, Dr. Krigger.
Thank you very much, Dr. Miller. Let's see if I can pull up these slides here. There we go. So I would like to thank the foundation for allowing me to speak on unmasking the impact of toxic stress and discrimination on health outcomes. If you look at the background of this slide, it sort of pertains what I'm going to be speaking of. All these pieces are not on the same level, but they are fitting, and that's sort of like how we are when we are going through life. Let's see. We're going to talk about identifying the historical and current toxic exposures to marginalized populations. That was my piece on this presentation. And I've listed some of the major groups: African Americans, immigrants, LGBTQ+, the disabled, the age. But I was reminded last week when I was doing a presentation to international undergrads that being a marginalized population in itself doesn't include individuals that are in specific physical spaces. And so they reminded me that being Jewish in a community or in a room or a classroom, or being a Muslim or Buddhist, or being the only female that's in a classroom can also mean that you're in a marginalized community. I am approaching this topic from my experiences with a couple of different areas. A few months ago, I gave a presentation on domestic violence, and talking to physicians, you mostly stress, what does domestic violence look like? What are your signs and symptoms of physical, mental, emotional, and financial abuse? What are the laws in Kentucky governing your actions? But I became particularly interested in the recidivism of individuals that returned to environments that were particularly hazardous to themselves or their families, either physically, mentally, emotionally, or financially. I also do some work in the Office of Diversity and Inclusion at the University of Louisville, and I'm very, very proud and pleased that those individuals have taken time to educate me over the years of some of the concepts I'm going to share with you today. So where we're going for the next few minutes, I ask your indulgence, please. We're going to review possible residual historical effects of toxic stress and trauma on generations, and current toxic stress assaults on marginalized communities. So research from mass cultural and historical trauma affecting subsequent generations, we have lots and lots of examples, and lots of these have been studied. I've listed a few here of the effects of mass cultural and historical trauma. The Holodomor mass starvation of millions of Soviet Ukrainians from 1932 to 1933, the Khmer Rouge killings in Cambodia, the Rwandan genocide, the Holocaust, families and survivors, Native American residential schools, families and survivors in US, Canada, and Australia, the slavery of African Americans, and we have data derived from Union Army prisoners of war and their children from the Civil War. We're talking about generational trauma. We're talking about neuroplasticity, and we're talking about terms epigenetics that you may or may not have heard of. The first study in this area was in the 1960s. The title of the article, Fearful Mouse Memories Passed Down Through Mouse Descendants. What they did was take a group of mice and put them in a maze and acquaint them with the pleasant smell of acetylphenone, which smells like cherries and almonds. When the mice would find them, they would be very happy because it smelled like food, but they would receive a small electric shock. And eventually the animals learned to associate the scent with pain. They would shudder in the presence of the smell, even without the shock. What was very interesting is that this reaction was passed on to their pups. Never having encountered the acetylphenone in their lives, the first generation offspring exhibited increased sensitivity when induced to its smell, shuddering more markedly in its presence compared with mice that had been conditioned to be startled by a different smell or that had never gone through any conditioning. And more astonishing was that this reaction to the smell of the cherries and almond in the third generation of the grandchildren of the original mice showed a reaction to the scent even without having been electroshocked before. So a growing body of evidence suggests trauma can be passed from one generation to the next. It can leave a chemical mark on a person's genes that can be passed down to future generations. It doesn't cause a genetic mutation, but it alters the mechanism of which the gene is expressed. This alteration is not genetic, but it's referred to as being epigenetic. This is toxic stress that is passed from one generation to the other. It is exploring the fact that we have genes. We've had the genome since 2003 now. So we know that we do have genes that can be turned on and off depending on what's happening in our environment. If a child grows up with an overload of toxic stress, their stress response genes are likely to be activated so that they are easily triggered by stressful conditions that don't affect those that are not grown up with the toxic stress. And even more importantly, this can be passed on to their children. Several factors such as stress, adrenal, gonadal hormones, neurotransmitters, as Dr. Andrea has spoken about, certain drugs, environmental stimulation, learning, and aging can change neuronal structures and functions. And these in turn can induce morphological alterations in brain areas. In neuromorphology, network alterations, changes in neuronal connectivity, and the generation or lack thereof of new neurons and the neurobiological balances. And we've got now, 60 years of work here. Neuroplasticity is the ability of the nervous system to change its activity in response to intrinsic or extrinsic stimuli, such as toxic stress, by reorganizing its structure, function, or connections. An emerging line of research is exploring how historical and cultural traumas affect survivors' children for generations to come. So what are other personal and current sources of toxic stress in our environments and those of our patients? And how does that affect our interactions as practitioners? Personal frames of reference of the people that come to us, whether they may have PTSD, what their ACEs score happens to be, implicit biases that we may have, or microaggressions that the patients may be facing. And then there are structural avenues of toxic stress in our environments and our culture, like redlining. This is a picture of a doctor's office in the 1920s in the South. I'm referring to personal frames of references of patients that you may have. Patients in their 90s, 80s, 70s, and 60s may remember there was a time of segregation in which going into the doctor's office as a person of color meant you went through the back doors, that you did not have equal access to services, that you were supposed to behave in a certain manner. And those personal frames of references are going to influence how your patients react to you and your staff when you render medical care. They will remember those times and that people really didn't go to the doctors because they didn't want to go through the back doors. And so when they presented, their prognosis was less than optimal because of the disease advancement. So if a person is called by their first name from your office and they're in their 70s, 80s, or 90s, they may experience some reactions of stress, toxic stress. Their blood pressures may go up that you may see because they weren't addressed by any sort of last name or title, Mr., Ms., Miss, or a professional title. In fact, they may have frames of reference in which that call by a white person may have been because they were the servant, the maid, or some other stressful situation in their memory. Post-traumatic stress syndrome, PTSD. Let's talk a minute about that. So I've taken some information lifted. This is certainly not enough for any diagnosis, but the beginning part of making the diagnosis from the DSM-5 is actual exposure to or threatened death, serious injury, or sexual violence in one or more of the following ways: directly experiencing the traumatic event, witnessing in person the event as it occurs to others, learning that the traumatic event occurred to a close family member or close friend. In cases of actual or threatened death of a family member or friend, the event must be accidental or violent in nature. So, how many mass shootings have we had in the US so far this year? As of May 30th of this year, which was the 150th day of our 2023, we had 263 mass shootings. A mass shooting is defined as involving more than 4 people. So if we had 263 incidences, and you multiply that by a minimum of 4, and then you think of all the family members that were affected by their family member being either close to or involved in, or the first line responders that had to respond to this and their family members were worried. We have quite a few people in our country that are subjected, could possibly have PTSD. This past Monday, July 10th, was the 20th anniversary of the Srebrenica massacre. In 1995, 8,000 Bosniak, mainly Muslim boys and men, were shot in Bosnia by Serbian troops. And that town continues to this day to honor their dead. And family members are still receiving body parts as they're still finding mass graves and they're being unearthed and identifications are made. They still are subject to PTSD. As Dr. Anger has explained, um, in his synopsis, I'm just going to take this from the DSM-5 of post-traumatic stress. These individuals who have it may have persistent or exaggerated negative beliefs or expectations about themselves or others or the world. They may have persistent distorted cognitions about the cause or consequences of the event, blaming themselves or others for what happened. Persistent negative emotional states like horror, anger, guilt, or shame, markedly diminished interest or participation in significant activities. These individuals with PTSD having the effects of this toxic stress can express irritable behavior and angry outbursts with little or no provocation toward people and objects. They're expressing aggression, recklessness, or self-destructive behaviors, hypervigilance, an exaggerated startle response, problems with concentration and sleep. Talking about ACEs, adverse childhood experiences. I like this cartoon. I'm afraid, said Rabbit. What are you afraid of? Asked Bear. I don't know, replied Rabbit. I just am. Then I'll sit with you until you're not afraid anymore, said Bear. We'll face it together. So most of our electronic medical record systems have ACEs for adults embedded, accessible to us as practitioners. You're going to find that it might be useful to you if you've got the patient who has multiple medical issues to go through ACEs with them and see if you can quantify some of the experiences that they've had. The first experiment or reporting of research on ACEs was in 1998, and they found a strong graded relationship between the breadth of exposure to abuse or household dysfunction during childhood and multiple risk factors for several causes of the leading causes of death in adults: diabetes, hypertension, hyperlipidemia, obesity. Our bread and butter is family docs in Kentucky. The ACEs questionnaire for adults is adapted from the work of the Kaiser Permanente and the Centers of Disease Control. I like this cartoon from Dr. Dan Siegel. The simplest way of defining trauma is that it's an experience that overwhelms our capacity to cope. So we develop maladaptive ways of working through our exposures to survive, whether we're in a household as children or whether we're adults as work or whether we're in Bosnia or any other country that is having significant impact or whether we are slaves in a country. So looking at the odds ratio of patients who have had more than 4 ACEs compared to those with no ACEs, individuals with 4 or more ACEs have an odds ratio of 7.8 for being victims of violence, whether it's intimate partner violence or sexual assault, an odds ratio of 8.1 for perpetrating violence, 4.5 for having PTSD, and a whopping 37.5 for suicide attempts, and almost 6 for STD occurrences. Another type of toxic stress is implicit bias, and it's a form of bias that occurs automatically and unintentionally, but nevertheless affects judgments, decisions, and behaviors. These are automatic reactions we have toward other people based on our past learning and expectations. It can be attitudes, stereotypes, and beliefs that are directed toward race, culture, ability, language, or gender. The good news is implicit biases can be mitigated with education. And the Harvard implicit bias study is something that I encourage everyone to periodically take. You'll be surprised at the results that you yourself unintentionally may be exposing your patients to. Another toxic stress that may affect marginalized populations includes microaggression, a statement, action, or incident regarded as an incidence of indirect, subtle, or could be unintentional discrimination against members of a marginalized group, such as a racial or ethnic minority. It can be indirect, subtle, or unintentional discrimination against members of this marginalized group. And there's a video that I'd like to share with you, and I hope Allie can help me with this so that I don't leave my slide set. I have to warn you, though, it has 2 words in it that I don't use in polite or unpolite language, but I felt the material within this video segment on YouTube warranted a little bit of toxic stress on our part to learn about microaggressions. Thank you, Allie.
Can you see the screen ready for the video?
Yes,
Okay,
thank
I'll
you.
play it now.
For people who still don't think that microaggressions are a problem,
Oh, you're so well spoken.
just imagine, instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while,
No, where are you really from?
Cleveland?
sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date,
Oh, your English is so good.
Excuse me?
going grocery shopping,
You know, everything happens for a reason.
I'm just buying apples.
commuting to work,
So when are you gonna have a baby?
watching TV,
We have to keep the Redskins' name. It's part of our culture and history.
or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up everywhere.
Do you know John? Give me shopping advice.
I love Cher too.
And getting bit by mosquitoes every goddamn day,
Can I touch your hair?
multiple times a day,
So pretty.
Can I touch it,
hair?
please? Can I please?
is fucking annoying. And makes you want to go ballistic on those mosquitoes, which seems like a huge overreaction to people who only get bit every once in a while.
It's just a mosquito bite. Who cares?
Just another angry black woman.
Of course, beyond just being annoying, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try less challenging, Major.
Ow, my dreams.
And other mosquitoes carry strains that can even kill you.
He looked like he was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic. Wow.
And by mosquito bites, we mean microaggressions.
Thank you very much, Allie, and forgive me, those online, if you were offended by some of the terminology that I didn't allow my children to say. I'm going to go back and share my screen to see if I can get back to my slides. There we go. So I'm sharing. Can you guys see that now?
We do.
Thank you. Now let's talk about another type of toxic stress, and I'm going to get into redlining. So redlining is an event that started in 1933 when the U.S. government created the Homeowners Loan Corporation to bolster the housing market and homeownership across the nation. It created these residential security maps, better known as redlining maps, to guide investment in U.S. cities. And because it was a federal law, every major city in our country has redlining neighborhoods. Historical practices such as redlining have resulted in poor, overcrowded housing, exposure to more severe levels of air pollution, which contribute to chronic disease. Redlined areas, when they were developed in 1933, and this process did not end until 1951, were restricted to industry, Black, immigrant, and low-income communities. So this is a map of redlining in Louisville. The red area at the top left of your screen represents Portland, Shawnee, Chickasaw areas, Algonquin of the city. The green and the blue over on your right represents Ford Forks and the beautiful park areas, the northeast part of our county. Zip codes 410, 11, 12 comprise an area of 3 miles radius where more than 121,000 people live, representing 51,000 plus families. If it were a city, it would be the third largest city in the state of Kentucky behind Louisville and Lexington. Only 40% of the population in this area have access to broadband internet. So if you're trying to do telemedicine to the population living in this area, as we discovered during COVID, it is a struggle. This area has the highest unemployment rate, highest childhood poverty rate in Jefferson County, lowest median income, the lowest educational attainment, the lowest life expectancy in years in Jefferson County, and the highest number of beta agonist prescriptions for asthma, because that's where the industry is as well. There are still, even though redlining officially ended in 1951, conventional effects of redlining. Refusal to provide delivery services in certain areas. Now, the west end of Louisville isn't the only redlined part in Jefferson County. Southwest Louisville also had a small contingency of redlining because we didn't have open housing to African Americans till 1963. And so a small carve out was made in the southeast portion of Jefferson County. And so getting delivery services can still be challenging, not to mention home health services for nursing care. Business loan denials, regardless of credit worthiness in the zip codes affected by redlining, still exist. Refusal to write property insurance policies or dropping property owners from insurance coverage altogether still happens. In reverse redlining in these areas, there are services that are offered to low-income residents at higher prices because their zip codes are in these areas, such as for car insurance, that's based on your credit worthiness, but it also is influenced by your zip codes. People in these areas can have higher interest rates and excessive fees or inferior products, and you see a plethora of payday loan companies, cash advances, and expedited tax returns. So I have finished my portion, and I thank you for your attention, and I welcome your questions toward the end. Thank you very much.